And of course, I have another question. Can you share a memorable experience from your international work that shaped your vision for global healthcare development?
Well, one of the first things that happened about 10 years ago, before I worked in Myanmar, was when I was invited by a third party to consult to the governor of River State in Nigeria. And so we drove a long, convoluted way to get to the governor's mansion, and I was talking with the governor about healthcare. And at the time, we were thinking about building a maternal and child health hospital right in the middle of Port Harcourt. Port Harcourt is the capital city of River State, and it took me probably an hour and a half to go half a mile from where we were staying at a hospital, excuse me, at a hotel to get to the governor's mansion. And I'm sitting there saying, "This is unbelievable. This town is just completely one big traffic jam." But he was telling me about the problem that they were also having in Nigeria itself, a much larger picture of problem where you have the tribal and the cultural, the ethnic animosities. You have Boko Haram. You've got the Christians at the necks of the Muslims, and the Muslims at the necks of the Christians, and it was one hotbed, one tinderbox, and I was thinking about that, and then I was thinking about the problem with getting to a place where we're going to build a maternal and child health, and I says, look, why don't we forget about the idea of building a hospital? Why don't we build small clinics in the periphery of Port Harcourt, out in the countryside, where people could actually access it? And I got a crazy idea. Why don't we get professionals from the tribal and the ethnic and the cultural area and get those professionals, those healthcare professionals, to all work together in these tiny little clinics, and then they can show the rest of the city, the town, the villages, what it means to care for peace,